Today we are expanding our segment Medical Minute, where we discuss health issues that could impact your life. Here to talk about that and a lot more, Dr. Richard Busch III. Doc, welcome to the show.
Thank you very much for having me, Tara.
Now, first of all, for the viewers who don't know, tell us about yourself and also your practice.
Okay. Well, we started in practice in 1996, so we're coming up on 21 years. Believe it or not, I got married the month prior to opening my practice. Not something I would recommend for anybody.
Chaotic.
Extremely chaotic. A lot of pressure there. But we have two beautiful daughters that are teenagers, and then we have a surprise 4-year-old son.
Oh,
and so, you know, we're just really enjoying raising him and enjoying what we're doing as parents now.
So it's been 20 years. Why did you decide to go into chiropractic care?
Well, my family has been in chiropractic for years. In fact, my family publishes a national chiropractic magazine called the American Chiropractor Magazine. My father retired from practice here in Fort Wayne back in 1982. And, you know, when I was in school in Dallas, I had the choice of either coming back here or staying in Dallas or someplace else. And, you know, for some reason, every winter I think, why did I come back here? But this winter's been pretty good.
It's been great.
Exactly.
I know. So when people are coming in, typically what type of patients do you see?
Well, we see a lot of patients that most other people don't really want to see. They're patients that are in chronic pain. They've, in a lot of cases, they've seen several other chiropractors. They've had physical therapy or epidural injections. They may have had surgeries.
Okay.
About half the people I see have had at least one failed back or neck surgery as well. So we use something called the DRS protocol when we're working with those patients.
I've heard the commercials, yes.
The DRS stands for decompression, reduction, and stabilization, and that's really what we're doing. We're decompressing a nerve or taking pressure off of it, reducing a disc bulge and stabilizing it all so the problem doesn't return. And basically we've been able to help thousands of patients not only avoid back surgeries, but even recover from back surgeries that they may not have gotten the best results from.
Typically, is there any length of time that you have to see someone, let's say a couple of years, a couple of months, or just it depends upon the condition they have? A
lot of it depends on their condition, and the patients that we're seeing have generally had, you know, like I said, they've seen multiple other doctors, and their only options are either, number one, to continue living with the pain, number two, continue taking medications, which in a lot of cases have very bad side effects, and then along with that, to have another surgery. So those are usually their options. Basically, we've been able to help those patients not only live a pain-free life, but regain their life. And you know, the interesting thing for me is when we work with a patient, I often tell people that we're not just helping that patient, we're changing their life. We're not getting them just out of pain, but we're changing their relationships that they have with their family, with their spouses, with their kids, and even the people that they work with.
Interesting. Dr. Busch, we're going to be talking a lot through the year. Nice to have you as part of the new show.
Thank you so much.
You can find out more about the Busch Chiropractic Center by calling the number that you see right on your screen. It's toll-free, or heading to buschchiropractic.com. Medical Minute is the second and third Monday of every month during our noon newscast. Now let's send it back to Pat.